Now that you're an old pro, it'll be a breeze to help our new guests.
I'd say it's a challenge. This iguana princess has a swollen jaw. Who knows what that illegal breeder did with her?
True, but Marshall here just has a bump on his leg and looks happy. For a bird.
Looks can be deceiving. And I know you don't want the doctor to speed through Biscuit. She's drooling and doesn't want to eat.
Oh yes, Biscuit's the sweetest cat. Forget what I said, Doc. Let's give these cases the time and attention they deserve. That's not a good sign. What's that reading telling you, Doc? You've got all the answers. Ouch, that looks painful. I guess these results could be worse. All clean and ready to go. These fluids will help bounce you back. Sorry, I know it's uncomfortable, but it will help. I promise. You think so too? I knew it all along. That'll stop infection. I'm on it, Doc. Actually, the mechanics noticed the problem. They were really concerned that she wasn't eating and appeared to be in pain. I got in a bit of a fender bender with my car. This is relevant, I promise. I noticed the mechanics at the shop putting out cat food, and they told me they'd been helping out this little stray. It's hard to say. She wandered into the auto shop anytime she liked and could have licked a variety of chemicals.
Biscuit was experiencing pain and difficulty chewing because of stomatitis, an inflammation of the tissues in the mouth. While there can be many causes of stomatitis, chemical burns were the cause in this case. Chemicals can cause contact wounds as well as severe illness when ingested. Fortunately, cleaning the wounds and preventing infection with antibiotics should help Biscuit recover. Of course, she'll have to remain in quiet seclusion until she can be declared healthy enough to join the other animals. Your diagnosis is spot on. I'm pleased. You knew to ask all the right questions. You did an excellent job looking after that animal.
Doctor, we have a new mother suffering from muscle
I can
spasms.
feel it.
I don't think we can wait on this one. She doesn't look too good. What does this reading tell you, Doctor? You seem to get what's going on here. Does this reading tell you anything? I can't fault your understanding of this case. I've got a clear reading here. Could that be the cause of the problem? That's close to normal, at least. I'm ready to give the right medication. Which one is it? This will help you feel better. Almost done. I've never made a mistake with medications. Just tell me which ones to administer, and I'll do it. I'll make sure she gets those supplements, Doctor. No, we have kept a close watch on her. Last night, Alice started to act restless and didn't want her puppies to nurse. The muscle spasms tipped me off, and Alice really needs to take care of her puppies. They are too young to eat solid food.
Alice had a case of eclampsia, which is caused by the loss of too much calcium during lactation. She had a large litter of puppies, and after a couple of weeks of feeding all of them, her calcium stores became dangerously low. This lack of calcium causes restlessness, irritability, muscle spasms, and eventually seizures. Alice could have developed brain edema, which is water on the brain. but the IV calcium that you gave her stopped her symptoms fast. She'll receive the special diet and supplements that you prescribed to make sure that she remains healthy while nursing her puppies. Your diagnosis matches mine. I'm pleased you knew to ask all the right questions. Your treatment of this case was perfect.
That's the swelling that I told you about, Doctor. Not good. Definitely not a positive sign. This was easily preventable. How sad. That's good news. This'll help you to get back to your old self. I've never made a mistake with medications. Just tell me which ones to administer, and I'll do it. I'll make sure she gets those supplements, Doctor. I can already see her perk up. No, her stool seems normal. Her jaw is swollen. Aside from that, she's lethargic and doesn't seem interested in climbing. Not good. Her jaw may be giving her some trouble.
Princess contracted a metabolic bone disorder due to a calcium deficiency. Most likely, her illegal breeder didn't feed her enough dietary calcium, so her body took calcium from her bones, making them thin, soft, and easy to break. Her bones could have become deformed and she might have died from malnutrition. An iguana needs sufficient UV light and heat, as well as the right balance of dietary calcium and phosphorus to thrive. The calcium and fluids you gave her set her on the right path. You have chosen the correct diagnosis for this patient. Quite insightful. You had all the right questions. Your treatment of this case was wonderful, and I'm sure your patient appreciates it.
See, Doc? That's the lump I told you about. What do you think it is, Doc? All clean and ready to go. What does that tell you? Sure, I'll administer the meds. Which one should I give? Very necessary. Whew, I'm glad that part is over. A clean wound heals faster. It's not too tight, it's just right. I sure want our animals to feel better, so which med should I give? Show off. Just kidding. He eats like Lucille, meaning he eats everything we give him. No, he's just as playful as the other birds. The pain in his leg seems to limit his movement, though. I'd say he seems to be protecting that lump on his leg and is limping.
Marshall may have bumped into something, but his owners didn't take him to a vet. An abscess formed when white blood cells rushed to the damaged area and died, forming the lump you saw. The infection could have spread to the rest of Marshall's body, causing sepsis or even death. By draining the abscess and injecting antibiotics, you'll allow Marshall's wound to heal normally so he can be adopted. I agree with your diagnosis. You clearly understood this case. You didn't ask one wrong question. I'm not surprised. Your treatment of this case was perfect.
Yes, she can eat soft food slowly. We just started giving it to her. She certainly doesn't seem weak when it's bath time or feeding tube time. She clearly wants to eat on her own. She really hates the feeding tube, and who wouldn't? There's my beautiful girl. Does everything seem normal? That reading's pretty clear, wouldn't you say? Show off. Just kidding. Results like this are the reason that I work this job.
Biscuit needed extra time to recover from the stomatitis. Now that the inflammation of the tissues inside her mouth has cleared up, she's eating wet foods on her own and has regained her strength. She communicated to the vet techs that she wanted to eat on her own and followed through. Since she's also no longer dehydrated, I think it's time to give her a clean bill of health. You have chosen the correct diagnosis for this patient. Quite insightful. You had all the right questions. You did an excellent job looking after that animal.
She's getting to be really friendly thanks to you. That's one friendly pet. She's getting to be really friendly thanks to you. The animals love playing with you. You're so great with the animals. They look really happy. She loves playing with you. If you're both having fun, you're doing everything right. If you're both having fun, you're doing everything right. The animals love playing with you. You're doing a great job at socialization. It's such a thrill when they perform a trick right. That's a step in the right direction. Looks like progress to me. What a great move! What a great move! That's a step in the right direction. Families love a well-trained animal. Perfect! You really know how to groom an animal. Nice and clean. You take such good care of the animals. She is so happy. You did such a great job of grooming her. You're such a pro. I've never seen such a silky, clean coat. I love my job, even with the smell of wet fur. She is so happy. You did such a great job of grooming her. Oh, they're so cute when they're wet. Good job. You really know how to care for animals.
You're doing so well treating the animals that they're being adopted left and right. Now we can rescue more animals thanks to you. With all your hard work, you deserve a promotion. I just need to ask you a few questions, but don't worry, I'm sure you'll do great. I knew you wouldn't disappoint. After doing such a good job on my quiz and with our emergency cases, I've decided to make you our next ER specialist. You've earned it.